Hello everyone, welcome to the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation and your host for this event. The Preemie Health Talks is the first of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. Next month, we're going to start the Preemie Power Week, and all the information for that week is already available on our website. Registration is free. These education sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANCE, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With the Preemie Health Talks and the Preemie Power Week, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world, which are extremely valuable to help us care for families and their babies. I want to thank AbbVie for the unrestricted educational grant, Pampers, and our amazing team who work really hard to organize this event. And today we have 3 sessions. The first one with Dr. Doug Campbell, followed by Annie Chirpich, who is a bedside nurse in Vancouver, and a preemie parent, Aruna Budram. So those sessions will be back to back. And right now we're going to talk with Dr. Campbell, who is here on the screen with me. And his talk is about the pandemic pregnancy guide and tips to survive the pandemic while pregnant or carry for an at-risk infant. Dr. Campbell described the pandemic pregnancy guide as a tool for parents. We're going to make the link available to his Instagram account. He's also going to provide a perspective on how parents in a neonatal setting can cope with additional stress. And then he says, a second wave, really? What new parents should expect? Dr. Campbell is currently the director of the Neonatal Intensive Care Unit and Deputy Chief of Pediatrics at St. Michael's Hospital in Toronto. He's cross-appointed at the Hospital for Sick Children, where he works regularly as a staff neonatologist. His academic interests include resuscitation of the neonate, and the use of simulation as a toolkit for healthcare organizations. He's the medical director of the Alan Waters Family Simulation Center at St. Michael's Hospital. He's also the simulation lead for the University of Toronto Faculty of Medicine. International recognition for his work in simulation has included election to the board of directors of the International Pediatric Simulation Society. Dr. Campbell, thank you so much for joining us here today. What a pleasure to have you here.
Thank you so much, Fabiana. It's great to be here, and I feel really privileged to be able to talk to your group. This is really exciting.
Thank you. So you can share your screen, and Dr. Campbell is going to have a presentation, and you can send all your questions, and I'll be addressing them at the end of his presentation.
Great. Hopefully everyone can see my screen. This is, again, I'm really happy to be talking to this organization, and thank you, Fabiana, and to all your team for really providing such great resources to all our families. And in a way, I kind of feel I should be learning from your group about surviving the pandemic in general, and also surviving the second wave. Of course, since we are learning as we go, which is never perfect, especially for women and families in crisis. But on the other hand, I think there's some lessons that we can learn. I'm excited to share my perspective to you today, and then excited to hear back from you, of course. So many of you might know about St. Michael's Hospital as a downtown city urban hospital in Toronto. It sometimes gets left out of the conversation about Toronto because it's dominated by Sick Kids and Sinai and Sunnybrook, the bigger level 3 hospitals. And that's where I work most of the time. As was mentioned, I do work at Sick Kids in the Neonatal Intensive Care Unit there. And one of the reasons I really enjoy working here is because our mission and values really talk about caring for patients and learning from patients. Patient care means patient perspectives. And and my neonatal career, I think we've changed a lot in how we provide care. We still have room to go, and I think the biggest thing we need to do is actually talk and listen to patients and parents especially more. So I'm very happy to talk to you about today. And so what am I going to talk about? I thought rather than just launch right into this pandemic pregnancy guide or PPG, I thought it'd be useful to talk about coping with stress and trauma for NICU families. I thought that would be a useful way to introduce this tool, because of course this audience needs no reminders of how traumatic it is to have an infant at risk in the NICU and even beyond. And Pandemic Pregnancy Guide, I think, is a really nice model for the future. And we'll talk a little bit about, where it came from and where it's focused on, because it's really changed over the last 6 months. And then what does this mean for the second wave? And, I don't have any perfect answers or perfect path for you, but I think the PPG guide is a really nice tool to make us think, and as parents, especially, and as champions of premature babies and sick infants, this might be a way forward for all of us, because who knows what's going to come back and come up in 2021. Hopefully it'll be a better year. Everyone agrees that, but I think we need to keep learning and learn how to support ourselves. So I thought it was useful to reflect on, and again, I've learned from my patients so much. So when you do medical school and you do residency and then fellowship training as a physician, you have this strange notion that you know so much. But of course, what they never taught me in medical school is critical as well. And my experience over the last 20 years practicing has taught me that you need to listen to families. And one of the biggest things I've learned, I continually to try to tell my team and the younger doctors, is that NICU families are trauma survivors. And when I worked at St. Mike's, a lot of our babies aren't the sickest, smallest babies. They aren't the 22-weekers. They aren't the 400-gram babies. And so I think it's easy for healthcare practitioners, certainly physicians, to think that this doesn't apply to those women and those families that might have older prems or full-term babies that are in the NICU. And in fact, I've learned that that's wrong. And I think it's okay, and hopefully we're in a society and a milieu in which we can talk about this more and share more, because the trauma of being in NICU lasts years, of course, and a lifetime. And when we use words like trauma, in fact, even when I talk about that today with my colleagues, some of them look at me with open eyes or question eyes. But I think it's important. My social workers and my team here keeps telling me it is trauma, Doug, it is trauma. And if we use that word, I wonder if we can then use tools that are more appropriately designed for parents. And I think it's really linking those things and having those difficult conversations, just like all of us are having nowadays about, racism and systemic bias, etc. Trauma, I think we should talk openly about it. And obviously, different solutions will exist for different families. And different families are affected, and different families have different resources and support mechanisms. But these are some of the things that I really learned and tried to take to heart in my practice today. And it forms the basis of what I'm going to talk about in the Pandemic Pregnancy Guide. And of course, the media is, in some ways finally picking up on this. The New York Times, the Atlantic, even Glamour magazine is talking about having an NICU baby is traumatic and using the word trauma over and over. And I do think it's sometimes media and feedback from parents and the public that helps transform healthcare, or should help transform healthcare. So I'm actually pleased to see these articles because I think we need to bring to the light how hard it is, how stressful it is, even if your baby is theoretically or technically not medically so complex for the healthcare team. And I can't even imagine I'm a father, I have 2 kids, but I've never had a baby, my own baby in the NICU. I've never had to worry throughout my partner's pregnancy. So the stress and the trauma that go along with that, especially during a pandemic, are impressive. And when so many traditional resources are cut off from us, family, friends, visiting, social distractions even, how do we actually access this? How do we make ourselves stronger? How do we create networks, a fabric that helps with coping and allows women especially to be stronger, and therefore helps their babies to be well. And ultimately, that's why it's an interest to me. Post-traumatic stress disorder, maybe not a surprise to this audience, but PTSD in parents of NICU is quite common. And the rates can be as high as 53% amongst moms, and even fathers, 33%. You know, there's a study, again, many of these studies are from the US, so you have to be a little bit careful about directly taking this data. However, one of the studies looked at an NICU follow-up visit survey, where they used a validated NICU graduate checklist tool that's been used in trauma studies in adults. They validated this study and found that there was moderate to severe PTSD in families for those not only who were extremely prem, less than 28 weeks, but those who might be considered more moderate preterm, and even full-term babies who spent time in the NICU. And so I think PTSD symptoms need to be recognized. Again, whether you use this language or that of trauma, I think we need to be thoughtful, we need to be explicit. It's not only for parents of extremely small preterm babies, but also those moderate prems, and that we should make efforts in the NICU setting, ideally before the NICU setting if it's predictable, and in follow-up care to provide support and counseling. And in fact, arguably the pediatricians and the neonatologists are perhaps the worst people to lead this. That's not our training. We should be there to guide and support the team, but promote the team and maybe involve better services. There are some level 3s that have good linkages with direct support, but many don't actually. And I think this is an area that we need to focus on. So I am not a trauma expert, I am not a psychiatrist, but I do think trauma treatment is important for our women in the NICU. We need to recognize mental health conditions, talk about them explicitly in pregnancy, talk about them and how they may change in the NICU and beyond, whether that's depression or anxiety or PTSD. We know anxiety is so prevalent in our society today, and even more so in a pandemic. And then what about chronic anxiety in the second wave? What about this chronic stress that especially women or families are undergoing? That probably changes things. Things that of course are perhaps obvious to some of you, like breast milk production, breastfeeding. But what about your ability to cope and your ability to talk about it and engage? So clearly there's professional support in the NICU, again, not the physicians, but healthcare team members such as our amazing nurses, social workers, counselors, parent support groups, family friend support. That's there, but it may be largely virtual nowadays. That's not a bad thing. Is that effective? We don't really know. I think it's a help. There may be resources, traditional ones for books, for example, Preemie Care, the one by Lasby and Churro may be valuable to people. I know there's virtual resources, and there should be. And in fact, the Canadian Premature Babies Foundation is, I think, a leader in this. You know, offers, clearly, this group offers online individual therapy for families or those who've been recently discharged. That's an amazing resource to have 2 online 45-minute sessions. That's great, including psychologists and peri-mental health experts. But what about parents? How about the parent support network in a pandemic? What resources? I mean, I was in our NICU today and thinking about our local Facebook group that gets organized for parents of our NICU. How do we make sure those supports are accessible and available and helpful to parents? There's lots of online supports, of course, and then there's social media, which is good, and of course it is bad. And that's what we'll touch on a bit today. And clearly parents quite rightly make their own parent groups, whether it's on WhatsApp or Twitter or Facebook. It's difficult, I think, for hospitals and organizations who are so concerned about privacy to advertise those or distribute phone numbers or WhatsApp groups or even Facebook groups, because it does create some challenges. You know, are you making that equitable to everybody? Who's going to maintain those groups? Are we putting burdens on parents, again, that already have a lot on their plate? Parent advisory committees, which we have at St. Mike's, but other facilities may not have that capability. So how do we navigate all these things? How do we make these platforms available? How do we know which ones work? Lots of good questions for we don't have access to, but I do think it's time we actually study them. And for that, we need parent support and parent investment and parent perspective to drive that research. Because it's quite one thing for our clinical team in a hospital to suggest something. It's quite another for parents to say, yes, this makes sense. And no, don't do that or stop doing that. And we need that feedback. And I think for the most part, we're keen to listen. Trauma support is something completely different. Now, family integrated care, of course, since it's been at least taken in different aspects by most NICUs in Canada, that probably affects trauma and how we define trauma. And I think we need to learn more about that and be explicit in how we talk about that. Peer support clearly is a key. Phone a parent, Preemie parent drop-in. We have a tea with a veteran NICU parent. All these things are great. And hopefully in a pandemic provide a dose of reality and some tangibles for parents. We have a holiday party, which is a huge thing for us at St. Mike's. Families come back and are so proud to show off their babies and their families and share. Now we can't do that now. So how are we gonna, having a Zoom call for 200 families isn't quite the same, right? So how are we gonna do that? How are we gonna move that forward? I do think parent stories are critical. I think we need to log them. I think we need to share them. I think they help us as healthcare practitioners become better. We have a board in our NICU like many NICUs do, and I've been keen to sort of share parent stories, talking about specific team members to celebrate experiences and memories. So I think these things, I don't know if they help trauma per se, but I do know I think they help parents, and they've told me that. And I think it's one of the things that really supports things like the pandemic pregnancy guide, because stories become a big part of it. Clearly, the more we talk about things, the more we should be able to help each other. There's clearly not a one-size-fits-all recipe. I think healthcare providers in general are often unaware of their impact on families. I know I remind myself that I remind my junior physicians and teams, like, you be careful what you say, right? Those families never forget. And I'm always astounded by how much they remember. But Dr. Campbell, you remember what you said to me that day? I'm like, oh, not really. Hopefully it was good. Because it's impactful. So how do we capture those moments and put them somewhere so that people, if they're good, they can model. If they're bad, we can stop. How can we share knowledge and education? I think we need to have specific parent-led communication strategies. We need to, so in the NICU now, we've changed our model of family meetings, right? There's often interprofessional team meetings with or without families, and then we try to set family meetings. So I want to have weekly Zoom meetings with my family. Is that going to be perfect? No. But if there are restrictions, that might be a way for other people to attend. We're lucky enough, St. Mike's, to have 2 parents be able to come in at all times in the NICU. I know not everyone has that luxury. But what about grandparents, and what about, friends of families? What about Zoom meetings? And yes, there's privacy issues, but let's have weekly, family meetings where we can really talk about the issues. And some will be medically focused, but my guess most of them will not be. And let's talk about how we're coping. So these are strategies that I think we need to reflect on and find out when they're effective. Maybe they're very appropriate closer to discharge, where I see many families, or maybe they're overwhelming initially in the first week of a prem's life, and we're just worried about hour to hour and day to day and pumping, right? So let's figure out the ways to alleviate and prepare parents. And ideally, of course, this starts before coming to the NICU. And so let's talk a little bit about pandemic pregnancy guided. And I was so happy that Fabiana reached out to me to talk a bit about this, because I think this is a good example to me of a platform that has really made a big impact on many women and their families in the last 6 months. But it's turned into more than that, right? It's turned into a resource for clinicians as well as parents and siblings and aunts and uncles and friends, so that they can support each other. And I have to admit, I turned 50 this year, so I'm not super young and hip, like my daughter is. My daughter and my son constantly roll their eyes at me about social media platforms. And they thank God that I'm not on Snapchat. I don't even know what Snapchat is actually. But Instagram, I think, and so I apologize if I put an Instagram for Dummies slide out there. Most of this crowd probably knows it very well. But you know, it's for those that don't, and for those that are still use Facebook or Twitter. I'm a Twitter nerd as well. But Instagram is a social media app that really was designed to emphasize photo and photo sharing and edit visual information. And you can react to it like with likes and comments and different emojis. And in 2016, they launched a stories feature to allow you to share videos or images, and these disappear after 24 hours. And this is where Instagram is actually similar to Snapchat in that it's sort of brief content. But it's more casual, and it's meant to capture candid videos and images and offering glimpses to people into their everyday lives. So that's the point of Instagram, at least that's what I'm told. I do have an Instagram account. I think I have like 30 followers, and I'm very naive on this. But one of the things I do follow is the Pandemic Pregnancy Guide, and I hope you will too. And really, you know, Instagram is made for the phone, right? So of course it's owned by Facebook, like everything else is owned by Facebook, but it was made for the phone. So, you know, for those who are now in their 20s and, you know, even 30s, the phone is how we communicate. The phone is what we do. Desktops and laptops are really, we use them, of course, but they're arguably less common, and maybe even the NICU even less common. So, you know, it makes sense that Instagram's more popular with those under 35, and it's better for branding and marketing. And you know, Instagram went from 1 million users in 2010 to over 1 billion in 10 years. So it's there. It's quick access, it's photo, it's visual, it's portable, it's there. And I think this is one of the reasons why I think the PPGs become really a big hit. And you know, this screenshot I took from Pandemic Pregnancy Guide was, you know, I think a week ago, and they had 12,000 followers. You know, it's really instant. And so this little screenshot you can see has sort of the top portion just summarizes its post, its followers, similar to like Twitter. But then down below, you see these little squares that are stories that are posts from Instagram that have more dedicated permanent information. And so you can just quickly scroll them to see, you know, it's like the one in the blue screen that says, I am pregnant, should I get my flu shot, for example? So really great questions that are instantly available on your phone. Because I think, you know, Fabiana, if I can speak for you, many of us put lots of information, but then we don't remember. I mean, I'm 50, I don't remember lots of things. So I gotta quickly remind myself, and this is a nice little place for everything related to pregnancy, everything related to babies, and even beyond. And I think it's nice in that's quick access visual for us to look at. And so this really took off. And you know, this Pandemic Pregnancy Guide was developed by two physicians at St. Mike's, a family medicine physician who does a lot of obstetrical care, and one of our OB physicians. And they teamed up with some medical students to put out information particularly to do with women who are pregnant in the pandemic. What do we do? How do we survive? That was its initial guide. And so its tagline is what to expect when you're expecting during a pandemic, right? And I think the nice thing about this is it's morphed and turned over the months into a much more interactive component driven by parents and driven by patients. So I really, really like that, because the feedback and I've been involved, and I've had a couple of videos that my children again roll their eyes at when I'm posted on Instagram, but I think they are of some value. And the feedback we're getting is that it's very relevant and very helpful to families, because they just want to have a topic, a quick hit on something, and they scan and there it is, boom, and they get a quick 1 minute, 20 minute. It's driven by physicians. It's, you know, it's fact checked with evidence, and St. Mike's is, you know, for what it's worth, as one organization that's behind it, but it's not limited to St. Mike's. The PPG goes to all sorts of healthcare providers all over. But I think that's reassuring for families. We've heard that, it's very reassuring. So I think it's a nice mix of parent-driven and physician-certified. I hope that's of value to you, and also other clinicians that are certified. So pregnancy obviously dominates a lot of the topics. So even things like Black Lives Matter, this is hugely important, right? And as healthcare providers, you know, many of us are white and many of us are not racialized and are privileged, right? So this was a big a way for us, frankly, to be more in tune with our families. Mental health, you know, so many questions. I'm stressed, I'm anxious, now I've got a pandemic. How do I cope with that? How do I get help if I'm pregnant and have these things? Wellness, right? Exercise, yoga, stretching. Can I run a marathon? Can I still do things? Preparing for birth, what can I do as a woman to get myself ready? So these were really parent-driven topics. We surveyed people and asked them, what do you want to know? This is what they wanted to know. This isn't, yes, there's information about, you know, or, you know, medications for anxiety safe in pregnancy. Yes, so that stuff is there, but it's really driven by topics for parents. I really think that's important. And then we can chime in and if need be, do interviews and things and have short videos on there for families. Birth stories, really important. Again, the concept of stories, sharing stories to alleviate stress and help to alleviate fears. Breastfeeding. In the pandemic, lactation support plummeted in downtown Toronto. I'm sure that was the case for many of us around North America. So how do we deal with that? What about virtual sports? Where do we go? What do we need to know? Discharge in the time of COVID. Oh my God, how am I going to send my baby home? I was relying on my grandparents to help me. The grandparents help me. What can I do now? And then it really morphed into postnatal visits, well baby visits, first year of life, back to school. Because the stress of, I think, all of us, as it changed from having a baby and then what about my other kids? How do I get them to school? I have a baby at home, I have other relatives. And so it's really turned into what parents are thinking and what partners of babies who might have been in the NICU or could have been in the NICU are thinking. So I think it's really, really gone from this, you know, pandemic guide to navigate, you know, March and April, which were a blur and a disaster for many of us, into a much more public, patient-driven, expert series, informed, myth-buster source to deal with COVID-19. And I think the modality was key to that. And so I think I could see this being hugely applicable to the NICU and high risk. There's lots of stuff in there around neonates, less about NICU, but maybe this would be an Instagram source for those of us who might want to take this on, right? And Instagram and healthcare, is this a big deal for clinicians? Well, I think personally, and as you might can tell from my passion, many of us who worked on this site think it's amazing for clinicians as we're learning things too. But in education, it's becoming a platform for ultrasound education. You know, and it's helping trainees and people learn about social media, the rising trend of likes, shares, and retweets, and for families who use this a lot, this becomes important to them. So we better become versed in this. We better become informed in this, whether we want to or not, frankly. You know, and Instagram was used in Zika. When Zika first came through, this was started to be looked at because these authors found it was helpful. This was published in a big public health magazine because it allowed clinicians and researchers to understand public sentiment and to focus areas of public health research and correct misleading and incomplete information and to expand messages to revert and to reach diverse audience. So, because of course as public health clinicians, we're trying to always reach people. Get rid of the disinformation. I won't talk about the US election, but get rid of the disinformation and reach people that you may not have been reaching before. And if you're not you know, resourced enough to have a desktop and an office, et cetera, or a job that allows you to do that, then maybe the phone's the way to do it. So maybe this is something we can do better. Autism. This is a study on autism and online social support and how do we use Instagram to change children's lives and therefore change parents' lives. So I think there's more and more research coming out. Many of you may know about Chrissy Teigen and her recent Instagram post on how she dealt with miscarriage. And you know, it's having celebrities using Instagram can be very powerful, and then of course not so good. But Instagram's use of hashtag allowed posts to be searched, right? And so people can search for, so in this case, hashtag funeral, hashtag miscarriage, and a very tough conversation to have about women who miscarry. But it allows that conversation to start. so users can speak to and hear from their own personal contacts and integrate into a larger community. So when Chrissy Teigen started sharing about her and John Legend's experience of losing their baby, it impacted a lot of people. I think opened up a quote unquote taboo topic for many, and to say, no, let's talk about this, right? Let's talk about this. And Instagram was the way this happened. And the combination of photo sharing and text may be particularly powerful. Image-based platforms may be better at alleviating loneliness and isolation. So again, I'm not saying that this is the answer to NICU and perinatal health problems, but I think there's increasing evidence that this should be looked at. And you know, and Chrissy Teigen's, and you know, this Grammy Award winner, you know, many people shared images of photos and artworks, and so this was a really big outlet for people. And the feedback is that it's a huge support and coping mechanism in the setting of pregnancy, in this case miscarriage. But wouldn't this be great if those in the NICU could use this? And maybe they already are, and we're not recognizing it and advertising it. Maybe we're not talking about it. And so I really would strongly encourage people to go to this guide. This is an article on the Star. You need Instagram to access the PPG. So if you don't have an Instagram account, by the way, I'm not getting paid for this. I'm not getting any extra likes for me. This is an article on the Star that talking a bit about it, the Toronto Star. And so that then we'll make the link available for you. But as we prepare for the second wave, which we're all in, I think, right now, which we don't know when the case numbers will go down. We don't know how this is going to affect, you know, future pregnancies and babies. Wouldn't this be a great way to formalize this, or at least one way we should talk about this? Because we may be in that boat there on the ocean, that wave's coming, right? Or we may be this person that you might barely be able to see on this screen. But if you're a high-risk mom or having a baby early, and many women are in the hospital, unfortunately, in their antepartum stay because they have eclampsia or hypertension or what have you, we might be able to see an opportunity to start not only reaching out to existing content such as CPBF, but what about Instagram what about pandemic pregnancy guide? Maybe we can develop a module for those expecting to have a preterm baby. Maybe that would be one step. A way to introduce virtual tours of the NICU so they're not as visually concerned when they come into the NICU. A way to introduce yourselves to caregivers who may be, there's lots of possibilities here. You know, and I think I think you had a talk or getting a talk from Dr. Narvi in Manitoba, but you know, for example, we know that the vast majority of newborn infants do not get COVID from their mothers, regardless of severity of illness. But we have seen recent articles develop that illness, of course, can happen in newborns in as late as 3 to 4 weeks after birthing, but this is still rare. So perhaps the stress is less about, at least from my perspective, about the baby getting COVID. And thankfully, breastfeeding and rooming in seems to be very safe, but maybe the stress can be, and the anxiety can be pointed towards something more common, like caregivers and visitor restrictions and supports, and how do I breastfeed, etc. So what are the second waves concern? I'm excited to hear from the audience today about what those might be. Healthcare, family accountability, PPE, hand washing, staff shortages. I know you're having one of your nurses going to talk about that probably, because staff are getting sick. And what about sickness and illness, and how do we navigate that in this time? So I'll stop there, and hopefully I haven't droned on too long, but I think the takeaway message is, you know, clearly NICU families, you know, prior to the NICU, during and after are traumatized, and we need more resources to help. Instagram and other social media applications have a role to play, both education and emotional support. The second wave is here. We have probably more questions than answers, but I think we're starting to see that there's a way to support women and families better. And how do we do that best? So I'll stop my presentation there, and I'm happy to take questions.
Dr. Campbell, thank you so much. That was an amazing presentation, and I'm so happy to have you here And I'm so happy they really stepped up to become a social media doctor. Parents do appreciate it. I'm going to read a comment from our live audience. She said, "This is amazing. I was cut off from all supports during our NICU stay out of province at the start of the pandemic. Being discharged to a small community without even a pediatrician leaves one nowhere to turn but online." So we need more resources like this. So fantastic. So, and I think her comment really resonates with all of us parents that we really appreciate. And I certainly remember going to a conference a few years ago when a speaker said parents should not go on Google to look for information. Okay, this is not an advice for today's, because obviously we all go on Google to search for things, but what a great way to find reliable information, evidence-based information. And I'm so grateful for all the clinicians putting that information out there and making it available for families. So thank you for doing that work.
Yeah, it's great. I mean, I think this is, you know, I shake my head when people say, "Oh, don't Google." Like, give me a break. I Google, right? Like why? Like, how can you make that a realistic recommendation? I think we need to be thoughtful and reflective of what we see. We need to share it with each other, just like trauma or anxiety or stress. And I encourage people to look, because I mean, to me, I've learned that stress and coping is huge. It helps the babies. Why wouldn't I want to support women to help their own babies? And that's what FI cares about. That's what everything we're doing is about. So we need to open our eyes and embrace it and own it.
Absolutely. Yes. So I just want to acknowledge that we have people from all over the world joining us here, from Abu Dhabi, a lot of countries in Europe, and all over Canada. So this is like a great way for us to spread reliable and evidence-based information. So thank you all of you for joining us here from so many time zones today. So Dr. Campbell, question for you. How are families coping for the last 6 months in the NICU during the COVID time? Because what have you seen from March to now? Because I feel that, I mean, the NICU obviously is a traumatic, as you start the presentation talking about that. And now we have this extra layer of stress. From your experience in your own unit, how do you see families coping?
So great question. To be honest, I don't think families are coping that well in general. I think what I've seen is this initial reaction, which is understandable, I think, by healthcare teams, by public health, to minimize any extra bodies in the NICU, period. What that did is clearly increase the stress level of our families. You know, we actually have less services in a way to offer them. One of the things we do here, many places do, is a volunteer team to help, right? And they help orient families. They help provide information when nurses are busy. They, you know, there's students that can be of support. They can distribute materials and talk to families. That's gone because we're not allowed to have volunteers in our hospital. So now a partner is not allowed to support that woman in the NICU, or they're in and out, and there's guidelines and about when they can visit. So we clearly saw increased stress. We saw, and it hasn't been proven, but I was so worried that we're going to have decreased rates of breast milk production, decreased times, and it's already a struggle and a stress for parents, in my opinion, to do skin to skin with their baby. So I saw less opportunity for that. I saw, you know, more issues with and frustration from families and anger from families, understandably, because they were, you know, even if they could come in, it was delays in getting to the hospital and just the whole PPE. There was misunderstanding, misinformation. People thought babies would get sick from COVID, and then isolation was a challenge. And that nurse is being careful. What's going on with that baby? Women were spending their labor by themselves because there was confusion. There was prenatally, if someone was admitted to the hospital, they weren't allowed visits. So I saw more stress, and I saw less effective care in the NICU. We advocated hard, and as the science came, we advocated hard for more parents to come. So having 2 partners, we deemed it an essential service. I think there continues to be advocacy for that, because around the world, I don't think that's the case. I think there's still 1 parent only, which I find is almost criminal when women are recovering from their own trauma, their own physical, medical concerns, and they're expected to be the sole care provider. And many places don't have facilities for these women to, so I've seen stress. I've seen it better in our hospital. When we put the 2-parent rule in, I saw stress improve. I saw feeding improve. So I've seen it with my own eyes. So I think we need to change things. We need to advocate better. We need to lobby and educate our own public health officials why care, for example, is a critical part of neonatal care. And so that means mom has to be there. So it's a unit to me. It's not even this is a unit. And then there should be someone to support that unit. So that type of language there needs to be, so education, advocacy, and support. And I think, so yes, we've been creative. There's more Zoom times, there's more resources that are developed. Maybe this whole pandemic has probably helped us to become more virtually savvy. And I think that's good because most NICUs are not virtually savvy. So that's a good thing from the pandemic. But I think we have, this pandemic has taught and reinforced to me that we can't abandon our mothers in NICUs. And that's what's happened in a lot of places, to be honest.
Absolutely. We're seeing all over the world, CPBF really joined the Zero Separation campaign that was launched by Glance to really keep the families together. And in November, I actually I will have a conversation with a mother from Northern Ontario who was transferred to Winnipeg in the first days of the pandemic. And she was alone in that province for a whole month and nobody came to stay with her, fresh C-section. Her story is absolutely devastating. So my question to you is, what have you learned from the last 7 months now that we are going into the second wave? So cases like that don't happen anymore. I mean, obviously, everywhere it's different in the world. We have a lot of differences also in Canada, but there must be, at least in Canada, because we have some standards of care, how can we learn from what we've done in the last few months, the beginning of the pandemic, when there were so many unknowns, to move forward now into the second wave that we don't really know how long it's going to stay?
Yeah, great question. I think the first thing we can do is be much better at keeping women safe from getting COVID in the first place. So hand washing, physical distancing has to happen. We probably need to focus on the bubble and minimizing exposures while you're pregnant. We know that women haven't accessed healthcare when they're pregnant as much as COVID, and that's a big risk. So I think, before having the baby, we need to do everything we can to make sure women access healthcare safely. There's still lots of women. I talked to a family this morning who was concerned about coming to a clinic appointment because she was putting herself at risk of COVID. The hospitals arguably, and the clinics are arguably one of the safest places to go to versus the mall or some patio restaurant. So that's the first and foremost, because it's true that women can get COVID in pregnancy. That's true. But we know, thankfully, that that's not common. We know that that's actually, for them to get quite sick is relatively rare. And we know that if women don't access healthcare, their mental health and physical health won't be treated, and there's increased stillbirths probably. And, and so those are the things we need to talk about: depression, mental health, which we know about. We know there's increased stillbirth rates in women with depression period and with mental health. And we know that if you don't access healthcare and you have symptoms that are hard to diagnose, like high blood pressure, you're putting your baby and yourself at risk. So we have to do that better. We have to prevent women from getting COVID, because it's true, COVID can affect women. And when women get COVID and are sick, they can have premature babies. We know that. Thankfully, the babies don't often get sick from COVID. That's great, because what that should do is reinforce every institution, every organization, every birthing center to breastfeed in room and with mom, even if you do have COVID. That should be number one. And that wasn't happening around the world before. So that has to happen so that breast milk production can be successful and that women can breastfeed if that's their choice. The other thing we have to do is keep families together. And so I think there's better understanding that seems to be safe. So let's use that information and knowledge and take that to administrators and change their policies. I think administrators are willing to listen, but people have to present the right arguments, and that's evidence and data. So we have that now. We didn't have that 6 months ago. Absolutely. So I think that's the big thing. I think and then when you have your baby in the NICU, your baby is unlikely. It's possible, but it's very unlikely your baby is going to get sick from COVID. So you have to keep yourself safe when you're at home, but come to the NICU and take care of your baby. So these are some of the things we've learned.
Okay, Dr. Campbell, but I feel that parents are still to this day seen as visitors. There's a lot of that terminology going around that, visitors. How can we possibly change that terminology and make the system see us as partners in care and parent and a baby? We are not visitors. Visitors would be maybe the grandparents, extended families, or friends, but those are like the primary caregivers of that child. How can we change that? Because this is, during the pandemic, I saw the word visitors popping up everywhere.
Yeah. So what we did is we lobbied our administration to change the word visitors to essential caregivers. Now, because most hospitals are big organizations, they don't always care, frankly, about, their priority may not always be labor and delivery. Their priorities might be ICU and emerge and COVID, which I understand. But there are always populations in hospitals that have to be prioritized. So what leaders of departments have to do, and parents can help inform leaders and demand from their NICU directors and department leads, they can demand that leaders and departments go to hospital administrators, say, we are a special population. So because family integrated care has to happen for my baby to be well, we know that. So that's language, there's evidence behind that. We know that we're essential because we have to breastfeed. No one's going to argue against breastfeeding. No one will. So we have to make those specific links and say we need to be a special population, just like palliative care, because if someone in a hospital is dying, they'll let someone in. So how do you get these exemptions? We need to be on a list of exemptions and yet be safe. So there has to be more direct lobbying, I think, at an organizational level, also probably at a provincial and a national level for a Canadian Association of Hospitals, for example, where FICARE is proven. Breastfeeding, rooming in with mom, safe. Check, check, check. Babies don't usually get COVID. Check. Parents are not going to put their kids at risk. You're still going to have PPE in the NICU, et cetera, et cetera. So take those facts, which we didn't have in March and April and May even. We have them now. Take the recommendations from Canadian Pediatric Society and then ask your medical leaders to demand change locally and nationally. I think it's the only way, because people don't, most administrators of organizations, apart from Children's Hospital, which are rare, are not focused on children and mothers. Because pandemic, they worry about ICU adults, which I get, and emerge. So that's how I think you have to change that.
Absolutely. So I have so many questions for you, but we're almost at our time now. But I want to ask you about the pandemic pregnancy guide. What are some of the recommendations for families who are about to deliver their babies throughout the winter, in the beginning of the second wave, or if they're expecting a high risk, they have a high risk pregnancy with the possibility of having the baby in the NICU. So what are your top recommendations for those families?
So my top recommendation is, please know that thankfully your baby's not going to be at high risk of getting COVID, number one, because most women are, no matter how much they read. Second, prepare your family and your resources and supports at home. So if that's a partner, great, make sure they're quarantined off work. If they're grandparents, that's great, quarantine off work. Auntie, sister from Brampton or other town near you, have them come and quarantine to be ready if possible. That's not always possible, but try to do that place. And the third thing I would say is eat well and plan post-discharge care well. So that means having a family physician, lactation support, have all these things lined up. How can I get lactation support in my organization I'm attending or after my organization I'm attending? Who can help me with that? Maybe it is a friend who's breastfed 3 kids. Because not all of us, of course, can access private support because it's financially draining. But those are things that I think often aren't overlooked. And people focus, of course, on their care, but in your checklist to get ready, know that your baby is going to be safe. Know your hospitals and policies, institutions, and regulations. Know your regulations and be prepared to fight if need be. Plan for safe breastfeeding, since most women want to use their breast milk, and get those supports in place prior to delivering. Those would be my biggest recommendations.
That's great, Dr. Campbell. Thank you so much for joining us here today. What a pleasure talking to you. I'm sure I'm going to bring you back next year for different topics because we have a lot to talk about. So thank you.
Great, thank you. Hopefully this was helpful. I look forward to more feedback from you and your team.
Absolutely incredible. And thank you all of you for joining us from all over the world. In 5 minutes, I'm going to be talking to Anne Chirpich, who is a bedside nurse from Vancouver, talk about the risks and fears of working in the NICU during the pandemic. And right after her, I have a parent who left the NICU right in the beginning of the pandemic. I want to thank AbbVie again and Pampers for the ongoing support to create these events this week. And CPBF is a registered charity, and 100% of all donations received during this week will go to our educational programs for families. To donate, please go to CanadianPremies.org. It takes only 3 minutes, but you're going to be making a huge difference in the lives of the families that we serve. And